Human trials are set to begin this week in Singapore as countries race to find a COVID-19 vaccine.
All set for August the 10th, Singapore and Malaysia finalise plans to facilitate cross-border travel for official, business and work purposes.
From marching contingents to the fly past, we go behind the scenes of this year's scaled-down National Day Parade.
Good evening, you're watching The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
And I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode.
An update on the COVID-19 situation here. 469 new cases were confirmed today. They include 2 community cases, a Singaporean and a work pass holder. There were also 15 imported cases who had been placed on stay-home notices upon arrival here.
Migrant workers living in dormitories made up the vast majority of the other cases. The total number of COVID-19 cases in Singapore is now over 50,800. More details will be released later.
Meanwhile, human trials for the Duke-NUS COVID-19 vaccine could begin in Singapore as early as this week. 108 healthy volunteers will be injected with this lunar COVID-19 vaccine developed by Duke-NUS Medical School and US pharmaceutical company Arcturus Therapeutics.
Preliminary studies on animal models had already shown that the vaccine was safe and didn't have any side effects. And if things go according to plan, results from the trial could be available by October or November.
Countries are looking to be among the first to secure sufficient doses to inoculate their populations. Singapore is one of 75 nations to submit an expression of interest to join the COVID-19 vaccine global access facility.
The COVAX financing scheme will ensure fast and equitable distribution of a vaccine so that those who need it most have access to it.
So there will be some element that the countries that are paying to develop these vaccines, the countries that are putting a lot of their funding behind rapid vaccine development are going to see some preference. I think that the one thing that will help everybody is that there are a large group of countries and organizations that are really working on a multilateral solution that will guarantee a certain percentage of the needed vaccine up front for all the countries that will sign on to this concept known as the COVAX. And that will allow countries to have enough vaccine to vaccinate the most vulnerable population, the elderly, people with underlying conditions, and healthcare workers. And then, that kind of mechanism, that multilateral mechanism, hopefully will counteract some of the negative effects that are going to be created inadvertently by vaccine nationalism.
Science correspondent Audrey Tan conducted that interview with Dr. Jerome Kim, and she joins us now. Welcome, Audrey. So, vaccine nationalism and how organizations can combat it, that's a fascinating topic. But before we get into it, I guess, how does vaccine nationalism occur in the first place?
So, as Dr. Kim pointed out during that interview, he says that it is inevitable that vaccine nationalism could develop. And this is mainly because there are many countries that are investing quite heavily in vaccine development, and they may have an expectation of reciprocity. So, for example, the US government has invested quite heavily in this. They have Operation Warp Speed. It's an initiative that involved the federal government pumping in about US $10 million to accelerate the development of a potential COVID-19 vaccine. And we have already seen some reports about how this vaccine nationalism could play out. So French pharmaceutical company Sanofi, its CEO went on record as saying that the US could get the vaccine first because the country had contributed a lot to its vaccine development project. So he later had to backtrack because there was some backlash from the French government and from the European Union. And that also raises the question of equitable distribution of vaccines, whether the countries and the people who need it the most would have access to that.
Then how do multilateral solutions like the COVAX facility, for example, help with countering vaccine nationalism?
So COVAX stands for the COVID-19 Vaccine Global Access, and the COVAX facility is a multilateral financing mechanism that would involve countries who have made expressions of interest, which is 75 to date, including Singapore. They would be contributing to the development and manufacture of a vaccine from their public finance funds. And from this COVAX facility, the countries can get access to vaccine doses for about 20% of its population. So that's one. And the COVAX facility also includes an additional mechanism that would try to get countries to voluntarily contribute to a fund which can be used for up to 90 other developing countries. So it could ensure that, everyone in the world would get access to vaccine doses. And Dr. Kim said during that interview that such multilateral solutions could be useful in countering some negative effects of vaccine nationalism that we've seen so far.
Right. Well, Audrey, there are 25 candidate vaccines worldwide, with 141 more in a preclinical phase. So do you think we'll end up in a situation where we actually have more than one COVID-19 vaccine then?
So I think that we already have vaccines in the clinical trials, which is human trials, is a good sign. And there were also recently published findings that have been encouraging. But I think it's still too early to say, which one would be the vaccine that we would see being rolled out internationally. So, I mean, if I could just go back to what a vaccine aims to do. So a vaccine aims to show the immune system an important part of the virus, and then training the immune system to be able to recognize the pathogen without actually exposing the patient to the risk of disease. And if I could use this analogy that I heard on a podcast, it's like, for example, if you want to train a classroom full of children to recognize a potential danger, for example, a wild bear, you don't have to actually bring the bear into the classroom. You could maybe show the children a photograph or a video of the bear and teach them how to behave when they do see a wild bear. So this is exactly what a vaccine aims to do. And right now, all the vaccines that we have seen all have different mechanisms of this training procedure. So for example, Duke-NUS, which is a vaccine being developed by Duke-NUS scientists in Singapore, co-developed they are working with an American pharma company to do this. Their vaccine aims to kind of like show the human immune system a video of how the virus is, so that it trains the immune system to produce your antibodies and T cells needed to combat this virus. So, all these vaccines have different ways of training the body, and I think it's still too soon to say whether we'll get one or whether we'll more. We'll just have to wait and see what the science shows us.
Right, well, fantastic. So thanks you so much, Audrey, for the analogy as well. That was the Straits Times' science correspondent, Audrey Tan. You can watch her full interview with Dr. Jerome Kim of the International Vaccine Institute on our YouTube channel. The link is in the description below.
Audrey also reported that Singapore is also piloting other novel approaches in its fight against COVID-19 in addition to its quest for a vaccine. For instance, a sewage surveillance program is one of several strategies that the government has implemented in the 6 months since the first case was reported here on January 23rd.
These initiatives are to complement and not replace existing COVID-19 testing methods.
Singapore has begun wastewater surveillance, or the sampling of used water for pathogens, as an early warning system for COVID-19. The amount of viral genetic material from wastewater from a community, such as in a foreign worker dormitory, could reveal the level of COVID-19 spread. This supplements existing outbreak management strategies, as wastewater surveillance could trigger response plans, such as individual testing and isolation.
So this pilot program has been carried out since end April, and NE has since tested more than 30 dormitories for COVID-19. So monitoring the virus concentration in wastewaters allows us to understand whether infection control measures have been effective. So for example, in a dormitory with no known transmission, if there is no virus signal detected in the wastewaters, this provides added assurance that the dormitory is clear of infection.
Sampling is an important part of this process.
The sampling process involves first identifying a suitable manhole for sampling. The manhole needs to be located away from the public, away from pedestrian walkways, and it has to receive the sewage from the community. The manhole also has to be of appropriate depth to allow our sample tubing to be launched inside for sample draw. After the sample has been collected, we will then come back to the equipment and transfer the sample in a safe way in sampling bottles to the laboratory. In the laboratory, the samples will then be tested, where the samples will be processed and concentrated for the virus, and then tested for the virus using a sensitive molecular assay.
Singapore is not the only country to be piloting a wastewater surveillance program. Researchers in Australia and the UK, among other countries, have also begun sampling wastewater to see if that could help outbreak control.
Still on COVID-19, researchers have found a way to produce test results in just 36 minutes. That's a quarter of the time taken by current testing methods. The team at the Nanyang Technological University's Lee Kong Chian School of Medicine said that the test can also be performed outside of a lab, and it works on the dengue virus as well, producing results in 28 minutes. A 2-week vector control exercise is underway to fight Singapore's dengue outbreak. The island-wide effort comes as the number of infections has surged to more than 20,000 so far this year. That's more than the annual total in previous years, except for 2013.
So why have cases shot up? One reason is the prevalence of the less common Den V3 dengue serotype this year, which fewer people have immunity to. Another factor is a spike in mosquito breeding at construction sites and homes in April and May during the circuit breaker.
So joining us to discuss this outbreak and what's being done to fight it is Dr Leong Hoe Nam, infectious diseases specialist at the Rophi Clinic at Mount Elizabeth Novena Hospital. Welcome back, Dr Leong. With more than 20,000 cases already reported this year, do you think the outbreak can be brought under control anytime soon?
Honestly, it's going to be really challenging. If you think about it, all this is about the mosquito biting someone. And if we try to curb and control the mosquitoes, they are already ahead of us easily by 2 to 4 weeks. So whatever we do now, whatever we intervene now, is going to show its effect 1 month later. So whatever it is, we are 1 month behind. And we are going into the traditional high peak season of dengue, which is July, August. So unfortunately, we're going to see big numbers. As you rightly pointed out, we have building sites. At the same time, we have a seasonal variation. Every 3 to 5 years, you get a big peak, and it is time for the big peak again this year. I think one other consideration is our work from home. COVID-19 actually has restricted us from going out to work, which means many people are staying back at home. And for the mosquitoes, this is heaven galore because they end up feeding on many people. With a full belly of blood, these mosquitoes will end up laying a lot more eggs and in turn propagate the cases further. The more dengue cases that are out in the community, the easier it is for an uninfected mosquito to find one and in turn spread on. The season, the temperatures, the uncontrolled breedings at home as well as the building sites, the new dengue 3, and unfortunately working from home. All these factors have come as a perfect storm to deal with us another bad blow of dengue this year.
Doctor, as you rightly mentioned that due to COVID-19 measures, people are more cooped up at home. So what should the first lines of defense be then to avoid getting bitten by mosquitoes?
To understand that the only way to get dengue is actually through a mosquito bite. If we can prevent the mosquito bite, we'll prevent any form of transmission. So mosquitoes are day biters. They bite very well in the early part of the day, at the end of the day. So those are the times you need to watch out for. Be careful that the mosquitoes will fly into the house. You don't even need to walk out of the house. So if in your own house, if you can, and you have the luxury of doing so, close the windows, switch on the air conditioning, which I don't think is very green. The alternative is actually get nettings around the windows so that you allow the air to come in, but not the mosquitoes. This way you protect your family and in turn prevent the dengue epidemic from getting worse. Number 3, even consider dengue repellents. Dengue repellents which you can apply on yourself, such as the DEET which is endorsed by WHO, or using of mosquito coils or other forms of mosquito repellents or even mosquito traps. Get rid of the mosquitoes and you get rid of dengue. For the individual, for those who actually have had dengue before, there's one additional aspect you can consider is getting the dengue vaccine. The dengue vaccine is very helpful in those who have had the infection before. If you haven't had the infection, taking the dengue vaccine may not help you. So if you had the infection before, go for the dengue vaccine and you can get yourself protected against the next dengue attack.
Well, thank you so much, Dr. Leong, for sharing the tips and advice, to ensure that you keep safe from getting infected by dengue. Now, we've been speaking with Dr. Leong Hoe Nam, infectious diseases specialist at the Rophi Clinic. Also in the local headlines, Singapore and Malaysia have finalized 2 cross-border travel schemes for long-term pass holders and travellers on essential or official businesses. Singapore Foreign Affairs Minister Vivian Balakrishnan met his Malaysia counterpart Hishamuddin Hussein at the midpoint of the causeway yesterday to discuss the arrangements.
The operational details of the 2 schemes, the reciprocal Green Lane and the periodic commuting arrangement, will be published in the next few days. To recap, eligible travellers for the Green Lane meant for those on essential or official business will have to take COVID-19 swab tests and submit their itineraries, among other measures.
The periodic commuting arrangement will allow Singapore and Malaysia residents who hold long-term immigration passes for business and work purposes in the other country to enter that country for work. Travellers under this arrangement will also need to take COVID-19 swab tests.
After at least 3 consecutive months in their country of work, they may return to their home country for short-term home leave and then re-enter their country of work to continue working for at least another 3 straight months. Applications for the schemes will kick off on August 10th.
Meanwhile, Dr. Balakrishnan said the 2 countries have also agreed to develop a proposal for daily commuters crossing the border for work. But this will not be in place so soon.
At this point, the reciprocal Green Lane and the periodic commuting arrangement does not provide for daily travellers. We're not ready for that yet. I would say give us a couple of weeks to monitor the figures both in Malaysia, particularly Johor, and in Singapore. And as we gain greater confidence that the control of the pandemic is well executed in both places, we can then begin the discussions for how we can allow daily commuting. But you must bear in mind that even with a daily commuting model, there'll be a need for regular comprehensive testing.
Good evening, I'm Dylan Ang. Here are the global headlines. Malaysia's Sarawak state has put a township on lockdown as it considers reimposing further travel restrictions and shorter business hours following a surge of COVID-19 cases. The State Disaster Management Committee declared Kota Sentosa and its vicinities in the state capital Kuching an active case detection area. The district reported 38 local transmissions and 14 imported cases in the last 14 days. Microsoft Corporation co-founder Bill Gates said that SK Bioscience, the South Korean pharmaceutical company he backs, may be capable of producing 200 million coronavirus vaccine kits by next June. The billionaire's foundation gave $3.6 million in May to the firm to accelerate its vaccine development. The Spanish government has insisted that Spain is safe to visit despite a recent surge in coronavirus cases. Several countries have reimposed travel restrictions to the nation in light of the surge. Citing other European countries, Foreign Minister Arantxa González Laya said that it is not unusual for the nation to witness new outbreaks. The number of infections has tripled in the last 2 weeks, with authorities monitoring more than 280 outbreaks, as they gave coach Maurizio Sarri his first major Italian title. In the Premier League, Leicester City's Jamie Vardy won the Golden Boot for the first time in his career. The 33-year-old is the oldest player to win the award after netting 23 goals. Manchester United and Chelsea also secured places in the Champions League with wins on the final day of the Premier League season. while Watford, Bournemouth and Norwich City were relegated. And those are the headlines around the world. It's back to you guys in the studio.
Thanks, Dylan. Now back home, this year's National Day Parade will be scaled down with just around 150 spectators, comprising about 50 government representatives, including ministers, and about 100 members of the public. NDP 2020 will be broken down into two segments, a morning parade and ceremony held at the Padang and an evening show at the Star Performing Arts Centre.
The participant numbers have also been reduced this year to about 300 in total. Performers will take 2 swab tests, with one done just before the show to ensure they're COVID-19 free.
The first rehearsal for NDP 2020 was held yesterday, and the Straits Times went behind the scenes for the morning ceremony.
NDP parade, which usually has a show component and a parade and ceremony component. We've always combined it. And the participants numbered in the thousands, 5,000–6,000, and the spectators numbered in the tens of thousands. And that was just not possible. What we wanted to do was to bring elements into the heartlands, starting with Prime Minister's message in the morning. It will be a very scaled down parade with just 4 contingents of Guard of Honour, and the number attending will be representatives of society. Instead of the tens of thousands, we will have about 150 members, 50 from government and 100 from the people sector and the population. Even though we have scaled down and we have 4 contingents of Guard of Honour, I mean that's still numbering in the hundreds. And they have been exercising a very strict discipline in terms of cohorting, in terms of ensuring that they themselves are well and that they have kept themselves free from infection, but we are always monitoring it.
I have been through as a reserve parade commander last year with a full parade also in front of Padang, and this year is also very special because I get to come back to Padang, and this is where our first parade after our independence started in 1966. So special to me this year is not just to commemorate our 55 years of independence, but also to pay a tribute to our frontline fighters and Singaporeans who have contributed to the fight against the COVID-19.
What is unique for National Day Parade 2020 is the mask-on policy. It was tough in the beginning because it's a little harder to breathe, but we planned a progressive training program whereby it acclimatizes them to the heat, the humidity, and the difficulty in breathing.
NDP this year, we started training a bit later, so we have had a shorter runway to actually go train ourselves to the level of proficiency and coordination we need to execute the entire parade. So the main differences is more of logistics, administration, as well as the parade sequence, because there are certain risk mitigation measures we have to put in place to ensure that our trainees train well but train safe. Right? So this includes wearing of masks, we have safety distancing, and even the parade, the contingent size is smaller. It's challenging, definitely, because even in this period with the COVID-19 pandemic, SPF is also affected. We have officers who are deployed for operations related to COVID. At the same time, we want to minimize the risk of cross-infection, so we have to come up with new measures to ensure that training is done safely.
I think as all Singaporeans know, it's a very challenging year because of COVID-19. We have to stand together and send a very strong message as Singaporeans that no matter what comes, rain or shine, virus or no virus, that our resolve to celebrate our National Day as one nation, our resolve to overcome our difficulties, and that's what National Day parades mean, and that's what they have meant since ever since our independence 55 years ago.
Now fret not if you haven't made any plans for the National Day long weekend. Grab your popcorn and get comfortable as more than 100 Singapore films and TV series will be progressively added to Netflix from Saturday. Among the titles you can look forward to include the internationally acclaimed family drama Ilo Ilo and Jack Neo's classic I'm Not Stupid. Iconic TV series like sitcoms Under One Roof and Phua Chu Kang Private Limited, as well as family drama Growing Up, will also be on the platform. Now, any series, Olivia, that you're looking forward to?
Well, I am looking forward to rewatching, the shows that we grew up with. I assume, Under One Roof, Phua Chu Kang. But I hope that, by these shows coming on Netflix, it'll give people like my brother, who's 8 years younger than me, the opportunity to watch all these shows as well.
Yeah.
I think he missed out.
Yeah, he certainly did. Any particular title that you're looking out for?
Did you say The Unbeatables?
Unbeatables, yes.
About it.
Yeah.
Before the show, they had Unbeatable, so I am definitely looking to see that one again.
So those are some of the titles that you can watch out for.
Okay, well, before we go, Prime Minister Lee Hsien Loong's new cabinet will be sworn in later tonight at 7 p.m. Tune in to our special live show for the full proceedings.
For more news and videos, you can always visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on A Big Story.